The study was a double-blind randomized controlled trial created to study children with sickle cell disease and low vitamin D. The aim of the experiment is to find an appropriate, safe, simple, and effective way to lessen vitamin D deficiency. The experiment was conducted on 38 children between the ages of 5 to 17. 18 of the children were given a vitamin D supplement to take, while 20 were given placebos. The data were collected both at home and at the clinic at semi random intervals. There were three different forms of tests that were conducted on different numbers of children: blood tests, urine collections, and questionnaires. The main form of data collection was the food frequency questionnaire, which was filled in daily by the participant on their guardian. This questionnaire was used to assess the vitamin D and calcium intakes of the participant and to determine their compliance. The participant was counted as compliant if they reported taking the supplement 4 or more times per week. Other variables that were considered while conducting this trial were the participants' age, sex, height, weight, body mass index, genotype, and more. The variables and baselines were analyzed using models and configurations that allowed for comparisons of multiple variables. The study was designed using a randomized controlled trial where the serum levels of 25-hydroxide D and calcium, the ratio of calcium to creatinine in the urine, musculoskeletal discomfort, quality of life, blood count, and bone marker assessments were checked at the beginning of the study as well as 3 months after the study. A randomized controlled trial is a trial in which participants are randomly assigned to one of two groups. One, the experimental group receiving the invention that is being tested, and the other, the comparison group or control receiving an alternative conventional treatment. The two groups are then followed up to see if there are any differences between them in the outcome. The greatest benefit of a randomized controlled trial is that it is considered the gold standard of research because it rests on its internal validity, which is based on reducing bias to ensure that the only difference between two treatments in their exposure to the treatment of interest. Reducing bias minimizes the possibility that the observed association between the exposure and outcome is really caused by a third factor. This allows the researchers of this study to determine effectively whether there is a difference between the two vitamin D supplementation strategies. This is a very important step in analyzing the results as it removes some of the impact caused to the validity of the results and helps eliminate incorrect assumptions about what caused to the observations and the trial's overall conclusion.